Good morning, my dear students. Today, my topic of lecture is Biomechanics in Orthodontics. What is bio? Bio is biology, and mechanics is the science of movement. Why should we know biomechanics? Biomechanics is a topic in orthodontics where lots of physics is being understood, and that will control the movement of tooth. Even mechanics is an engineering science. When it comes to the medical side, the biology, we are thinking about moving the tooth and also the bone. That is why an orthodontist is also called a dentofacial orthopedician. It involves even movement of bone during growth. So, biomechanics for tooth movement is to have a control of tooth movement with mechanics in biology. There are some terminologies that can be used. That terminologies used should be understood by a student. Once you understand these terminologies, it is easy for you to understand what happens in movement of a tooth or a bone. Force. Force is an act upon a body which moves or tend to move a body from its state of rest. This is very simple. If somebody is asked what force is, they will just say it is an impact. But it is an act upon a body which will move or tend to move. There are some static bodies where you apply force. For example, if you apply a force to the wall around you, which is constructed with bricks and plaster, it will not move, but it tend to move. Opposite, the reaction is you move. So it is an act on a body which moves or tend to move a body from its state of rest. Now, every body on Earth or otherwise, on any planet or otherwise in outer space, has got a center of that body. The center of the body is the center of the mass of that particular body. But when there is an environment where there is gravity, that same center of mass is called center of gravity. Whereas if there is a resistance present along with center of gravity, for example, a tooth with the root is inside the alveolar bone. So if somebody tried to apply a force onto the tooth, the resistance is offered from the alveolar bone where the root is present. So another terminology what all of you should know is about the center of resistance. So what is the center of resistance? It is a point or an area where the force is concentrated. For example, when you apply a force with a wire and a bracket onto the tooth will try to move, but it is being resisted by the alveolar bone and the periodontal ligament which supports the root of the tooth. So normally the center of resistance is in the apical third of the root of the tooth, because that is the area which is inside the alveolar bone. Now there is a similar terminology to center of resistance, that is center of rotation. So if the force is applied to the center of resistance, away from the center of resistance, sometimes far off from the center of resistance, the tooth tries to rotate. The point at which the rotation happens and the body when it is rotating, it is called center of rotation. Center of rotation will keep changing, but the center of resistance will not change. Center of resistance can change apparently only if the surrounding structure like the alveolar bone has got a bone loss, or if there is a weak periodontium. Apparently the center of resistance will change, but center of rotation is something which always keep changing to what type of tooth movement you need. Different types of tooth movements are possible. So accordingly, the center of rotation will keep changing, but the center of resistance is constant. Now you see this animation. When a force is applied, what happens? The tooth is moving. The force application is far away from the center of resistance. So the movement, what you see over there, is tipping, in which it is an uncontrolled tipping where the crown moves back and the root moves forward. But the center of resistance remains the same. The center of rotation moves more apically. That is, towards the apex of the root, the center of rotation moves. Center of resistance remains the same. That is the alveolar bone in which the root is embedded and the crown portion is visible. See the center of resistance. Always understand center of resistance is in the apical third of the root. Now when you try to move a tooth, there are some optimum force that is to be applied for the biology to be preserved. So the different types of tooth movement to which optimum force what is used will give you more of stability and the preservance of biology. The movement what you get is with quality. So it is defined as the forced. So now optimum orthodontic force is to be applied, but you should get a desirable biology response with very minimum of tissue damage. Now you should know certain authorities has proposed this optimum force with their research findings. One among them was Martin Schwarz, who proposed in 1932 the optimal orthodontic force. That is approximately the capillary blood pressure. What do you mean by that? The capillary blood pressure is the pressure exerted in the capillaries, which are minute blood vessels that you see surrounding the tooth. So when you apply a force, the tooth goes and compresses the capillaries around that. So if it exceeds the capillary blood pressure, that can cause a biological damage. That is the reason why you should preserve the blood vessels around the tooth, the capillaries, and from there, that will nourish the tooth root and surrounding areas wherein biologically acceptable movement happens. So what are the optimum forces that is required for different tooth movement? You just note down what are the different types of tooth movements possible orthodontically. Tipping, bodily movement, it's also called translation, root uprighting, rotation, extrusion, and intrusion. Now for tipping. Tipping is a very simple tooth movement which is produced, as I explained to you in the last slide. A force is applied to the crown portion of the tooth. The tooth moves with the crown little bit from the point of application of force, and the root also moves accordingly in the opposite direction. So When you have a very simple tooth movement possible with tipping, the amount of force, optimum force, that is 35 to 60 grams. Whereas, if you think about moving a tooth with the crown and the root moving together or hand in hand simultaneously, translation, that is 70 to 120 grams of force. Why? When you would like to move an object bodily, the resistance is more. Whereas when you try to move an object only at one point, the resistance is less. So when the body is moved bodily, it requires more of force. That is why the force is increasing in a range between 70 to 120 grams. Now, you would like to move only the root through the alveolar bone. There also, it is more than a simple tooth movement tipping. So the root uprighting force is approximately 50 to 100 grams. So next is rotation. Rotation is also a simple tooth movement which is possible, which is 35 to 60 grams. Whereas extrusion, which will be helped by gravity. Gravity is also helping an extrusion. Very simple tooth movement that is also in between 35 to 60 grams. Intrusion, when it comes to intrusion, it is also a movement where very light force is to be applied, because an intrusion is a force which the root is pushed from the crown area, the root is pushed more gingivally. An upper or lower dentition which is to be pushed more gingivally. The apex of the root goes and hits the alveolar bone, and the bone is to remodel for an intrusion to happen. So if you apply a very heavy force, more than 20 grams, what will happen? That root will wear off or resorb. So you should understand one thing, for the biology to be preserved and also the root to get into a new area of the bone without resorption or without a biological damage, you should apply a very light force, that is 10 to 20 grams. Now, another terminology that you should know is moment. Moment is the tendency to rotate. Very simple way, if somebody would like to know what a moment is the tendency to rotate. So a tooth, when the force is applied, even if you say it is tipping, it is a type of rotation. What happens? It is changing its position from its original position and moving on to a new position by having a rotative tendency on the tooth. Mathematically, or for calculation purpose, it is a formula, the force, capital F, multiplied by the perpendicular distance, D, from the center of resistance to the point of application of force. Now you see this particular diagram, wherein small d is inside a bracket from the center of resistance to the point of application onto a bracket, and force is being applied with an arrow mark in one direction. The tooth is supposed to rotate and move. So what is the calculation for a moment? Capital M equals capital F multiplied by small d, which is in force is in grams and the distance is in millimeters. So your moment is in gram millimeters. For example, 100 grams of force or 25 grams of force or 30 grams of force applied to the tooth with a distance of 10 millimeters. 10 millimeters into 25 is 250 gram millimeters of force. If it is 30 grams of force, it is 300 gram millimeters of moment. That is what is created. I have told you force, but this is moment. Moment is force multiplied by perpendicular distance. Another terminology that what you should know is coupled. It is two equal forces, equal in magnitude, but opposite in direction. Now, when you see a couple, why do you want to know these terminologies and understand the application? Couple, as I mentioned to you, it is equal force, equal in magnitude, but opposite in direction. That is because you would like to derotate a tooth, what is rotated. So if you would like to apply a couple, that couple is applied for the example what is shown there, a rotated central incisor. So a rubber elastic chain is being connected onto the tooth on the palatal aspect. Another rubber elastic chain is being connected onto the labial aspect of the tooth. Ultimately, what happens? The tooth will try to rotate on its axis. That is a pure moment. As I mentioned to you in the last slide, moment is the tendency to rotate, but the rotation can happen on its axis or away from its axis. If it is on its axis, which is a pure rotation or pure moment, that is called a couple. Equal force, equal in magnitude, opposite in direction. The couple can be applied not only for a rotated tooth, it can be applied for a tooth for it to move with the opposite end, that is the root. There also you apply a couple for a torque to be created. That we will come to know in the next slides what are coming. See both the arrow marks. These arrow marks are moving in opposite direction. So arrow with a head will give you a direction. So it is in an opposite direction, this lines moving with the arrowhead. It should be of equal magnitude and it should be applied in opposite direction. Now also you should know for a control of tooth moment, moment to force ratio. What is this moment? The moment, as I mentioned to you, is a tendency to rotate. But here the moment is called as a counterbalancing moment. And the force, what you see here, is a moment of force. Don't get confused. You just understand very simple way, moment. Moment is the tendency to rotate. Whether it is a moment of force or a counterbalancing moment, that will create a rotation. But you should understand when a moment of force is applied, the tooth will try to tip. Whereas a counterbalancing moment, when it is applied, it will try to balance with that rotation. What is this balance of rotation? That rotation will not cause an uncontrolled movement. There should be a control from the operator or the orthodontist. So if a force is applied, that is to be countered by another force, which gives you a control of your movement. So the force applied is the moment of force. Again, moment to force ratio is the counterbalancing moment to the moment of force. For that only, I will give you an example. If the moment of force applied is 100 grams and the counterbalancing moment is 1000 grams, 1000 grams, then what is the ratio? 1000, that is counterbalancing moment, is to moment of force, that is 100 grams. So 1000 is to 1, the ratio is 10 is to 1. So like that way, when you alter the ratio from 1000 is to 1, then 700, 1000 is to 100, then 700 is to 100, then 600 is to 100, you can alter your type of tooth movement. You would like to have more of counterbalancing moment, then it will cause more of a movement in the root area. Whereas if your moment of force is high than the counterbalancing moment, it will cause more of a crown moment. But if your counterbalancing moment and your moment of force is equal, that will cause a bodily movement. Now, students, you should understand physics, mathematics. When you apply all these things to biology, biomechanics will happen or an application is possible. Why should you know all these things in theory? When you apply all these things on human beings as patients, you should be able to achieve a result like correction of any types of malocclusions. The tooth movement is possible when you have a control of it and then you know the scientific facts of it. That is the only reason why you think about moving it with the science, that is biomechanics. Now, I have explained all these things to you, and with an animation, you see what happens when the moment is generated. The moment is generated on the crown of the tooth, which has got a bracket fixed on the crown on the labial aspect. The force is applied and the distance is calculated. So moment is force multiplied by distance, 10 multiplied by 10, that is 100 gram millimeters. Now, I have taken the bracket apart. When inside the bracket you see a black square, that is the arch wire that will be inserted into the bracket. And you see both the arrow marks. One is coming down, another one is going up. That also means that that bracket is in control on the labial aspect of the tooth. That bracket is like a handle and the arch wire inside will apply a force or a pressure for that bracket to act on the crown of the tooth, which gets transmitted onto the root also, and then the tooth movement desired will happen. You see the animation where the crown on which the force is applied through the bracket and a counterbalancing moment is applied on the root of the tooth. This is how the theoretical explanation is practically possible with some animations what is created. So moment to force ratio is how, as I mentioned to you, 100 is to 10 or 10 is to 1. That is a bodily movement or a translation, what is possible. What are the different types of tooth movements? Tipping, as I mentioned to you, a force applied from or through away from the center of resistance, it causes a crown to move in one direction. See now, a force is applied and this force is creating a movement of the tooth and the tooth moves to the next position, that is called tipping. Depending on the application of force away from the center of resistance, closer to the center of resistance, you can have two types of tipping. One is controlled tipping, another one is uncontrolled tipping. So you need to have a control. In certain malocclusions, you have to apply a force close to the center of resistance. Whereas if it is an uncontrolled movement that you require in some malocclusions like bimaxillary proclination, you apply a force that will change the direction of the tooth in an uncontrolled way that is also desired sometimes in some malocclusions. You apply like that. So again in animation, you see the force applied and you see torquing, the next type of tooth movement. When a couple is applied on the body, it causes torquing. Where do you apply this couple? As I mentioned to you, equal and opposite force, equal in magnitude, opposite in direction. So here, a couple is applied for torquing to happen because you would like to move the root also, and you tend to move the crown, but it is being protected from movement by the arch wire. So for students, for you to understand a torquing means you make the crown remaining in the same place, move the root back. So it is like a root movement more than the crown. That is called torquing. Bodily movement. Bodily movement is what is expected out of a tooth movement in the recent advances in fixed orthodontic appliance, like pre-adjusted edgewise appliance. We use a fixed orthodontic appliance. Lay people call it braces, but the recent advancement is you get programmed brackets or the handles, what is fixed onto the crown of the tooth, which has got some programmed prescriptions inside the bracket that will help a bodily movement. You would need to just understand an appliance which causes a bodily movement. But what is a bodily movement? Through the center of resistance, a force is applied. So the bracket creates a force transmission from the crown to the root to cause a bodily movement. So the application of force onto the bracket, because there is some prescription inside the bracket, which allow the transmission of force to the crown, from the crown of the tooth to the root of the tooth, and it causes a translation of the tooth bodily back. That also should be in agreement only with the biology. If you try to move the tooth bodily like what you see in the picture here, there can be an amount of root resorption or a bone loss. So how to get a bodily movement? Normally, we tip the tooth and upright the root. This is how hand in hand biology is being preserved. So the bodily movement, what you see here, can be achieved by the displacement of the object. Object here is the tooth. The displacement is from one place, the tooth is moving to another place. First the crown, then the root simultaneously. That is how you get a bodily movement. So it passes through the center of resistance. Animation. It shows that the arrow mark shows that the movement is through the center of resistance and application of force. See, the tooth is moving bodily. As I mentioned to you, in an animation, you can see this, but it is like walking. You stay in one place, you stand from that particular place, try walking to another place, you move your front leg forward, then the back leg also comes forward. So you get bodily displaced from one place to another place. This is the same way in biology, the tooth walking. So when the tooth starts walking, the crown will move first, then the root will move second. This is how the tooth gets bodily displaced. What you see as an animation here is practically possible only by like a walking of a tooth. Intrusion, that is another tooth movement that is possible. That is a balance between labial and lingual aspect to the center of resistance. Why I specify this? You use orthodontically some appliances which can be a labial appliance or a lingual appliance. But as I mentioned to you, where is the center of resistance? Apical third of the root of the tooth. This is a 2D picture what you see. But you take any object which is 3D. These are all 3D objects. So the center of resistance is neither labial nor lingual. It is in the middle between the labial and lingual. That is why I mentioned there for you to understand. It is a balance between labial and lingual to the center of resistance. See, the center of resistance is between the labial and lingual in the apical third of the root of the tooth. So when you would like to apply a force, the force which is applied from the crown area towards the gingival, the crown and the root has to move up, or if it is in the lower arch, down. That is called intrusion. See now, an arrow mark is kept there. That arrow, the direction of the arrowhead is up. That is for a tooth which is in the maxillary arch. If it is a tooth in the mandibular arch, again, you make a common terminology with you for you to understand. Gingivally directed forces are all intrusive forces. Okay, so one thing that you should have in mind is, for you to understand and remember, is gingivally directed forces are intrusive forces. See now, arrow mark is going up, and that causes an intrusion, which is in the maxillary arch. Now, opposite of intrusion is extrusion. Balance between labial and the lingual, as I mentioned last time. That is why, because the center of resistance is in between the labial and the lingual portion of the root. Incisally or occlusally directed force. Like last time I mentioned, gingivally directed for intrusion, incisally or occlusally directed force for extrusion. Arrow mark moving towards incisal or occlusal. Rotation, another type of tooth movement. Force applied by a couple to cause axial rotation. What is coupled? Again, we will remember equal and opposite force, equal in magnitude, opposite in direction. So if you want a pure rotation, pure moment, you apply a force as a couple. Whereas moment is a tendency to rotate. That moment is a force applied off center to that tooth. That means away from the tooth center of resistance. Then what happens? The tooth will simultaneously drag and rotate. So in situations where you want a dragging and the rotation to happen, you apply a moment, which is an impure moment that causes a dragging and rotation. You want a pure moment, axial rotation, you apply a couple. This is in animation, and you see an amount of rotation. Whereas in the above picture, you see an axial rotation. There are types of forces that you should understand. Continuous force, intermittent force, and interrupted force. Continuous force, intermittent force, and interrupted force should be understood well, because different appliances what we use in orthodontics gives you different types of forces, which is also important for the biology to be preserved. So now you see, every diagram what is drawn is a graph between the x and y axis. In the x-axis will show you the time, and in the y-axis it will show you the amount of force. See, when you read the rate of decay, and you also see the continuous force, ideal spring, and also you see the reactivation force. Now, a force is considered to be continuous if its magnitude does not decrease appreciably over a period of time. Don't by heart what is written over there. We as operators, as orthodontists, we see patients once in a month. Fixed appliance orthodontics is in the control of the operator. Patient need to just visit the orthodontist once in a month. So once in a month, when the patient is visiting the orthodontist, we are changing certain components, and certain components are still fixed onto the tooth. In that, for example, we have got certain arch wires which goes through the bracket slot, and the arch wires sometimes are not changed, but the force element is changed. What is the force element? The force element is a moment of force that is generated. As I mentioned to you, moment of force can be with rubber elastics, or else elastomeric chains, or else a tie back, which causes the tooth to move with the arch wire in place. Arch wire will guide the tooth movement, but the force element will allow the tooth to move by application of an amount of force. An orthodontist changes the force element every appointment when the patient comes. Arch wire need not be changed sometimes. So the arch wire will act as a continuous force application. That is why in this particular graph, there is no break. It drops down to 0, but there is no break or there is no space between each reactivation. Whereas when you see the next type of force, that is intermittent force, the force declines to 0 with magnitude intermittently when the appliance is removed by the patient or clinician. Removable orthodontic appliance. What is given normally for retention purpose? The patient removes, or by his or her own will, it is removed at the time when he or she wants. That is why it is called intermittent force. So in the graph, you see spaces in between. Any time the appliance can be removed and the force can be discontinued, it can be reactivated, and in due course, that is going on like that with the time. So that is regarding a removable orthodontic appliance which can be removed by the will of the patient. Interrupted force is also something which breaks in between, but with the operator's control only, it can be removed. For example, if a quad helix appliance is fixed in the patient's mouth, which is a fixed expansion orthodontic appliance, which can be removed only by the operator, that is why after some time, it is being removed, taken out of patient's mouth, fixed back. So there is a space, but it is not every day or at any time of your will. It can be with a continuous force applied for some duration, but taken back from the patient's mouth. That is why there is a space. That is called an interrupted force. In conclusion, biomechanics is the endeavor of the clinician to produce tooth movement in the desired direction using force systems that are ideal for that individual case. The force system chosen should produce as little damage to the surrounding tissues. Both practically and theoretically, light continuous forces is ideal for producing desired tooth movement. Now, coming to this conclusion, I would like to know whether you have understood what is biomechanics and the biology and the accompanying tooth movement. Thank you.